Good evening. Thank you all for coming. Welcome to our AGM. It's really good. Can everyone hear me? Okay. Yep. Really good to see people from general practice, people from the CCG, colleagues from other provider organisations, and a very big welcome to some members of Salus' own staff. Last time we did anything remotely like this, we didn't have people working for us, so it's absolutely fantastic to see you here tonight. Now, I'm under strict instructions from Jackie that I must explain what Salus is, just in case anybody in the audience isn't sure. So we are a federation of 23 local practices, which means effectively we're a company limited by shares, and the 23 local practices within the North East Hampshire and Farnham CCG are our sole shareholders. Our business is providing high quality services, sensible services for patients, and working at scale across practices and working across and within localities. One thing that really hasn't changed from the beginning is that we've always said this is about providing good services for patients, but it's also about making general practice feel better for those of us working within it. I've been asked to introduce the board to you. Sorry to be embarrassing, folks, but if you could put your hand up. I'm Nick Hughes. I'm a GP in Farnborough. Wait for it, Steve. I'm Nick Hughes. I'm GP in Farnborough, one of the directors. We have two practice manager directors. We've got David Giles, who's practice manager at Victoria Practice in Aldershot. We've got Sarah Smith, who's practice manager Border Practice in Aldershot. Our GP directors, we've got Gareth Robinson, who's clinical lead and GP in Yateley. Steve Scott Perry, GP in Aldershot. And then here with us tonight we've got Jackie Stevens, who's our development director and working with us on secondment from the CCG. We've got Mandy Jones. Mandy's an ex-local practice manager and is our admin and development manager. And then one person who's not here with us tonight, but I should mention, she's cruising the Mediterranean tonight, Sharon Boylett, who a lot of you will know, has recently accepted an appointment as our Associate Director of Nursing. So I'll just quickly go through the plan for the evening. We're going to just do a quick progress report. Are we really starting to make general practice feel better? David's going to then whiz through the finances. We'll then have a short break and get on to what for us is certainly the highlight of the evening. Ben Gowland from Ockham Healthcare is going to talk to us about the future of general practice. There'll then be time for questions at the end and hopefully some healthy discussion. So I'd just like to take you back to January the 14th, 2016. We took part in the CCG's first ever target event for local practices. We'd been tasked by the local Vanguard programme with taking the temperature of local general practice. We'd visited nearly all 23 local practices, and these were the things that were concerning practice managers and GPs at the time. Workload was a huge concern, for some bad enough to be affecting their own health. Recruitment and retention of GPs was a big problem. Financial problems, locum costs were really contributing to that. Premises, quite a few practices felt their buildings weren't really fit for purpose. There were lots of complaints about not enough time to spend with patients, particularly those with complex needs, and lots of other concerns. General practice really wasn't feeling like a good place to be working. 80% of GPs and practice managers felt that we needed to change and that we needed to change significantly. So what have we been up to since then? Well, first and foremost, we are a provider organisation, and I'd just like to mention three of our services. The first two we've been involved with for some time, for over a year, and the third one is rather more recent. We took over the running of the local enuresis clinic from a large provider organisation. Currently, we've got 94 patients in active stages of assessment or care. We then have discharge to assess. So we have 6 beds in Ticehurst Nursing Home in Aldershot, and Southleigh Practice have done an excellent job providing the medical cover, regular ward rounds, regular multidisciplinary team meetings. The idea is that people can quickly be discharged from hospital and then get the assessments they need done in a more appropriate setting. They can then either go home after a period of rehabilitation, or if that's not possible, onto a longer nursing home place. Our worry, of course, was that people would get stuck in the beds, but they don't seem to be. Presently, our average length of stay is 48 days. Also like to mention one of our newer services, which is the Oasis Mental Health Drop-In Centre in Farnborough. It's been open since mid-April. It's an easy access drop-in centre run along the lines of the very successful Safe Haven in Aldershot, open every night of the week, 7 days a week. So we've said that workload was perceived to be a huge problem. So what have we done to try and help with this? And what have we done to try and help with this in a climate where we're being expected to do many more things in the community, outside the hospital, and to do that with fewer GPs? I think many of us would agree that increasingly skilled teams are going to be necessary. So that's what we've done. We have 6 clinical pharmacists working across 18 of the local practices. They're helping us with a variety of things: repeat prescriptions, medication reviews, prescription advice and queries on the telephone, face-to-face consultations as well. We've done a piece of work recently to try and offer a standard range of services to the practices that they can choose from according to their needs. So we're running hypertension clinics, lipid-lowering clinics, vitamin D replacement advice, asthma and diabetes are planned. One of our pharmacists has even been involved in mental health care planning. Paramedic practitioners have been very important, are very important to us. They're now working across 4 localities. We've got 7 already on the staff. One's due to start shortly, and one is yet to be recruited. The paramedics are doing home visits for the practices. They're also working on emission avoidance work. They're working very closely with Salus and community staff within the integrated care teams. We think they're providing a great service for the patients. They're helping to take some strain off general practice, and we think the figures are starting to show a significant impact on hospital admissions. Advanced orthopaedic practitioners, these are highly qualified physiotherapists who run assessment clinics into which patients can be booked directly so they don't have to come and see the GP first. The service is up and running in Yateley, Farnborough and Aldershot, and we've just requested bids from providers to start the service in Fleet. The figures vary, but we know that at least 20% of GP consultations are for musculoskeletal problems. We ran a successful and very cost-effective pilot in partnership with one of the Farnborough practices last year, and we feel we proved the concept locally. The service is provided to practices 1 session a week per 5,000 patients, and that's a 4-hour session during which they'll see 14 to 15 patients. So if we take, for example, a local practice like mine with 11,500 patients, the practice will have 35 to 40 patients a week seen via this service, and nearly all those patients would have had to have been seen by a GP or a nurse practitioner. So we feel we are genuinely increasing the capacity of local general practice. We now have contracts in place to utilise Vanguard Funding in Yateley, Farnborough, Aldershot and Fleet. Enhanced integrated care is a really important part of the plan for each locality. Now the existing members of the ICTs are working at full capacity. So for example, we can ask perhaps community nurses to work a little differently, but we can't ask them to work more. So that's why new staff are going to be needed, and particularly if we're going to start doing more proactive things using risk stratification tools. Of course, all the activities of the agencies working within the integrated care teams, they need coordinating, so we're not duplicating work, we're not treading on each other's toes, hence the needs for care coordinators and admin support. So not all these services are delivered directly by Salus staff, but it looks like by the end of this year we'll have nearly 30 members of staff working for us. So have we made progress towards our goal of good services for patients and making general practice feel better? Well, we think the new services are high quality, we think they're safe, and we've had some very good feedback for patients, but certainly they need development. We have been very lucky because of the Vanguard funding. We've had Vanguard funding to get us started, which many other areas haven't. So the question is, are these services going to be sustainable? This is the third and the last year of the Vanguard funding, so what happens next year? We think that the news there is so far so good. If we just look at some figures, these are emergency admissions for Q1, and we can see Aldershot emergency admissions down more than 6%. ACS emergency admissions are ambulatory care sensitive emergency admissions. Those are admissions where an intervention in the community may prevent an admission. Farnborough emergency admissions for the first 3 months of this year down nearly 10% compared with the same time last year. Now I've blatantly cherry-picked those figures from the Vanguard metrics, but I think if you talk to any senior people within the local Vanguard programme, they'll all say it's early days, we could have a bad winter, but so far the figures look very promising. Finally, are we making general practice feel better? Well, yes, I think we're starting to. We've had some positive feedback. We've been particularly pleased to hear some younger GPs saying that the new services are making them think more positively about their future careers. But of course, there's a very long way to go, and I'm going to end on a slightly sobering thought. We're all used to hearing about national BMA figures, a third of GPs are going to retire in the next 5 years, etc. But what about locally? Does this really apply to us? Well, the local Vanguard programme has just commissioned a very detailed workforce planning report, and just some of the headlines. So local practices are still spending nearly £1 million annually on locums. 19% of our local GPs are within 5 years of retirement, but that assumes retirement at 60. And if the trend for earlier retirement continues, I think that figure could easily become 35%. They give best and worst scenarios for all sorts of different reasons, but it looks like we're going to need to find somewhere between 31 and 65 new doctors in the next 5 years. The figures for practice nurses are even worse, with 62% of our practice nurse workforce within 5 years of retirement. So we're going to be needing to find a lot of new nurses in the next 5 years. So probably what we should be aiming for is, it's not really good enough to be saying, for our existing workforce to be saying, yeah, it's feeling a bit better. What we've really got to be able to show in the future is that we're making a difference to recruitment, that new people are going to want to come and work in an attractive, interesting, new way of working in general practice. And we're also going to be wanting to hear from our practices that they're being able to rethink their medical and nursing staff requirements because of the skill mix we've introduced. We're not there with that yet. It's one for the future. So I'm going to leave you with that and hand over to David, who's going to talk you through the finances.
Principally, Nick has talked about what we've achieved as an organisation. I just want to spend a few minutes talking about how we've achieved it. Have we achieved the goal that we set out? We set ourselves in the beginning, which is very much about building an organisation that's capable of delivering primary care at scale. And bear in mind, we set about this some 2 years ago when nobody was really certain what delivering primary care at scale really meant. And one thing became very, very evident very early on, and that was that we needed some sort of organisation that would tick all the boxes for all the other provider organisations, because it's no good us marching in somewhere and saying, yeah, we're Salus, we're the GP Federation, you know all about what we're doing, and everybody's saying, yeah, but tell me about your information governance, tell me about your finance, tell me about where you store your data, tell me about your staff, all that sort of stuff. And it was that kind of stuff that we very, very quickly learned we had to be right on the money and actually have in place before we could go to some of the bigger organisations. So just a quick look at some of the things that we've had to do, and indeed some of the things that we have got in place. I'm not going to bore you with them. Some of them you've been a party to, because right at the beginning, you guys, or at least some of you guys in this room, parted with £100,000 and said, here you are, directors, have a go with that, see what you can do with it. And I'd like to think we've done what you asked us to, and maybe we'll get to prove that towards the end of this. We started off with a shareholders agreement, board of directors, and all the usual stuff that any limited company has. We had to go through, as I say, all sorts of information governance. CQC registration is a really, really bizarre one. Everybody talks about, you must be CQC registered. You go to the CQC and they say, what is it you're doing? Well, unfortunately, you can't be registered for that because it's not a regulated service. When you're delivering a regulated service, come back and talk to us and we'll register you. And so it went on. At last, I'm pleased to say we are doing something that is a regulated service, so we can now apply for registration. That is in progress and should be resolved fairly swiftly. As Nick said, we didn't have any staff right at the beginning, and now we've got 29. And that's absolutely incredible, from my perspective. I still can't believe it when I look at the payroll some months and think, how on earth do we get so many people, and have to spend so much money every month when we started with nothing just 2 years ago. But obviously there's an awful lot of stuff goes with having all those people on board, and all credit to Jackie and Mandy, who did a hell of a lot of work getting all the policies and stuff in place and the recruitment processes that we've got. Some of you in the room have gone through those recruitment processes and know that they were well managed and very effective, and I'd like to think we picked the right people. I'm looking at you because they're wearing Salus tops here, but you're the easy ones to spot. Obviously we had to be registered for tax and so on. One of the most bizarre things that we had to navigate our way through was actually joining the NHS pension scheme, so that our staff, despite working exclusively on NHS contracts, could actually continue to be in the pension scheme. And it took us a year, Jackie, I think, to actually get through the myriad of hoops that they threw in front of us, but eventually we got there. And I'd like to think that at the end of all this, we've actually got a credible organisation that is capable of doing what we set out to do. So now let's quickly look at the figures. It really will be quick, and then I'll shut up and go and sit down. Starting with the income streams, and in the year we started, we turned over all of £106,000, most of it coming in the form of Vanguard Funding to do some work for the Vanguard team. Last year, that shot up to just under £900,000, which I think you'll agree is quite a jump. And as you can see, most of that came from delivering local services through localities. A lot of it at Yateley, we were involved in stuff there. And of course, the clinical pharmacist program, which is a big service there at the top. And in the current year, we expect that to rise to over £2 million. So from £100,000 to over £2 million in just 2.5 years so far, and it'll be 3 years at the end of that, I think is indicative that we're doing something right, and we're certainly convincing some of the right people that we're capable of delivering the services that we say we are. Looking at the other side of that, the one thing that we set out not to be is an organisation that sucks money out of the NHS. We didn't set out to make huge profits for our shareholders. Sadly, I know some of you are our shareholders. We set out to be profitable without taking huge chunks of money out and giving it back to our shareholders. Of course, with huge profits comes huge taxes as well. So, you know, if we made £100,000 of profit, that's 20 grand straight to the taxman. So, you know, we want to avoid that if we possibly can, whilst remaining on the right side of profitable. So first year we did make a small loss, that's not surprising. And one of the interesting things you might want to look at, if anybody finds anything interesting in these figures, is to look at the overhead line at the bottom there, the last two lines, and look at the 33 and the 14,000 as a proportion of the total expenses. Massive amount of money, because we weren't doing very much business. Jumping on to the next year, that figure's risen quite dramatically, but it's now a proportion of over 800, nearly 900,000. It's around about 10%. And this year it's going to be even bigger, but a proportion of a much greater number. And we're starting to be, a sensible, credible organisation. Taxable earnings we're trying to keep low because we're trying to spend the money on delivering frontline services. As I say, we're not about making huge profits for our shareholders. And that's really the message that I'd like to deliver tonight. Is we have gone from nothing to creating a vehicle that is capable of delivering services, and through the good auspices of the CCG, NHS England and so on, we have invested, or we will have invested this year, close on £2 million into general practice and primary care services in our locality. And that's money and people that weren't there 2 years ago. And hopefully, coming to what Nick was saying, that's what will ultimately make general practice feel a little better. So if you can hang on to that message, I for one would be very grateful. Right now we're going to take a short break, then you'll get the star of the evening, Ben Galvin, who's going to entertain you and regale you, I'm sure, with some wonderful wonderful messages about what the future of general practice holds. So take a break, get a cup of coffee, and we'll resume in about 5 minutes.